So there's many opportunities for public health planners to have an important role in the cancer control planning process in their regions and in their states. So for example, many excellent providers are already out there, whether they be community-based or based in healthcare, that are already delivering quality programs for cancer survivors. So sometimes simply helping to serve as a channel where existing programs and services can network, can identify what programs and services are being offered and where, is a really important role that public health planners can play. That is, again, creating a network and a method for communication, also a dissemination route for education about cancer survivorship, whether it be through the healthcare system or to cancer survivors directly, is another key route for public health planners. With the growing trend toward the utilization of evidence-based programs, is going to be especially important as survivorship programs are being developed and implemented, that we also have very strong evaluation programs so that we can prove the worth and the benefits of these programs. And there are some very good tools available. The American Cancer Society, through their Resource Center on Cancer Survivorship, has published some good tools that give some guidance on how to develop a logic model and how to identify outcomes, and importantly, how to validly measure those outcomes for cancer survivorship programming. The George Washington Cancer Institute also has some terrific programs available on the internet, again, that can serve as guidance and a template for you when you're considering how to design an evaluation program and how to measure its effectiveness. So although it might seem overwhelming when we consider the complexity of needs in the cancer survivor population and the myriad of issues that they're facing, the great thing is that there's terrific reports that have already been published on this issue that can be of great use to public health planners in trying to consider what the needs are of the population and how to address them. They're wonderful resources, no matter how far along an institution or a program is in their cancer survivorship planning. What's also important to know is that the CDC has an ongoing monitoring system through the Behavioral Risk Factor Surveillance Program that does periodic enumeration of cancer survivors by type, by time since survival, and also can help in terms of the public health planning process. And so when we're thinking about where and how to identify evidence-based programs for survivors, in addition to these landmark reports that document the needs, there's also terrific resources for identifying specific programs for cancer survivors. For example, NCI's Cancer Control Planet is a web-based program that allows you to specify the population and the setting and the need that you're trying to address. And you can readily identify programs that you can pick up off the shelf and have very good guidance on where and how they can be adopted and how they can be implemented. Most of these are for psychosocial interventions or for physical activity interventions. There's other really good guidance from the American Cancer Society, where they've published multiple iterations of systematic reviews of the literature on nutrition, physical activity, and other habits for healthy living that are specific for cancer survivors that can serve as a great template for where to start with program planning. Other agencies such as the American College of Sports Medicine, the National Coalition for Cancer Survivorship, they all have resources for programs. And Susan G. Komen and the American Cancer Society also have local chapters that can be great resources for cancer survivorship planning and development.